Hi guys. All right, this one's painful because of the visual. Try to just ignore it. I almost did this one in sunglasses, but I decided to suck it up and just do it. Okay, so this one's going to be on duration of the time that they're here in therapy. Obviously, there's no clear-cut, specific expectation of exactly how long a person's going to be here. So many factors go into this, so there's just no real way. Again, kind of like the 2 times a week is a good rule of thumb in a normal situation for the consistency of a patient coming. I would say from a tissue healing standpoint, acute, subacute, or chronic, 6 to 8 weeks is reasonable. Now, this is also where you're just going to use your discernment. So being able to recognize that not every person is created alike. There are plenty that will be independent in their own home exercises, and that'll actually really make gains for them with their care. And there's others that really need to be here. And then there are some that really need to be here and can't be here, and some that really don't need to be here, but it's easy for them to get here. So ultimately, 6 to 8 weeks is a good expectation for them to have. Reinforcing to them that they are not a cookie cutter recipe that we're just going to stick into a algorithm or a protocol and just expect for something to pop out the exact same as it does for someone else. I think it's actually a really helpful component for them to be able to realize that this is care based off of their body and how it's going to respond, and it's a dynamic process, and sometimes it's 2 steps forward and 1 step back, and just allowing them to have that expectation is really helpful, because I think they may feel like they are being defeated if they thought, or the doctor thought, that it was going to be 2 or 3 sessions just to learn some home exercise at PT, and they go on their way and they're better. And that doesn't happen, and then they get discouraged. So I just want to be realistic with them, but also clear that we don't have the 100% answer. I think that's going to be the most life-giving way to approach what is the duration of time that they will be here. I tell people, I use the terms, we are a stepping stone for care. I think that helps to frame their mind around, it's not that they're coming to PT, we're going to wave the little PT wand on them and they're going to get all better, or they have to come to us forever because we're now their person. That's not the way we approach our practice. So we want to see them improve, and then we want to see them go and fly and do things on their own. So I think just being able to, again, use that stepping stone analogy, and I would also be mindful with, as you're interviewing them essentially at their evaluation or at their reevaluations, just to really be mindful of what type of person they seem like they are. Do they seem like they are committed and want to get this over and done with? Or do they seem like they really are putting the responsibility on you to get them better? And I would just be leery of the ones that are the latter half, because they then don't seem to know how to transition. Yes, we need patients in these doors, and that's a great thing, but our goal is not to keep them here. Our goal is to be that stepping stone for them. So that's just a brief reinforcement of the duration. And again, research shows that about 70% of people who begin PT do not see it through to the end of their plan of care. I want to be part of the change in that. I want them to take that ownership and responsibility for their healing process and be a huge, helpful team member in the process, but also ensure that they are recognizing that this is their journey, and we're just along for the ride to be able to help them and support them in as many ways as we can, and making sure that they're clear on that from the get-go, and that they're not a recipe cookie cutter, like we do X, Y, and Z with every single patient, and then on day 61 you're out. Like, it doesn't work like that. So all of that is helpful to really keep in mind as we're talking to the patients about those questions of how long do I have to be here? I'm kind of over this, just kind of troubleshooting through those questions.